Yeah, I'm Helen Chilvers. I'm a senior lecturer in the School of Health and Social Care working on our post-registration postgraduate portfolio, and I'm going to talk about, well, actually I'm going to talk about myself and my teaching really. So without further ado, I'll go to my slideshow and then I will share my screen. She says, this is where the technology will fail immediately. So, have you all got PowerPoint showing? That's the bit that I'm most concerned about. Can you see my slides?
Yes.
Fantastic, thank you. So yeah, I'm going to talk really about my teaching with part-time adult learners. So this is me, as I said, and it's going to very much be a stream of consciousness talk. As you can see on the left-hand side of the slides, in 1989, I left school with 3 O-levels, so I'm not a classic higher education pupil at all. I carried on, went into nurse training at the tender age of 18, and I've been a nurse all the way through, carrying on getting various qualifications until in 2017 I came to join the University of Lincoln, and I've worked here since on the postgraduate offer that we offer in the School of Health and Social Care, and completed my postgraduate certificate in clinical teaching and practice education recently. And the reason I'm showing you all that really is because those are the students I'm going to be talking about. So these are my students, and we're going to talk about what is learning anyway. Well, most of my practice is with these people who are postgraduate part-time learners. They're post-qualification healthcare professionals who are already senior and experienced in their jobs. We've got Andrea there, who's a breast care clinical practitioner, and Becky, who's a lead for a critical care outreach team. And Julian is a general emergency practitioner. So for them, learning's about reforming and refocusing their attention around their understanding of their roles, the concepts and themes that inform their practice, and looking at their actions in practice and the sort of new understanding of policy, looking at wider systems thinking, leadership theory, and developing the ability to articulate the complexity of their roles. So a lot of their roles are groundbreaking. They're moving across different service boundaries, so they're not working in traditional hierarchical forms in the NHS. And along with that comes this concept of othering that's really, really important in their experience of both learning and studenthood. So Webster Wright in 2009 discussed the themes of transformative learning and workplace learning in the roles of continuous professional development in healthcare, building on sort of Meserov series and so on. And this is really important to my experience of working with my learners, who they're experiencing change in their work identities. So this concept of liminality, this sort of working in 2 spaces at once and reshaping and reforming all the time, and the transformation of their professional selves is really important. And it extends further as they're often not only doing that in learning in the university, but they're actually doing it at work at the same time. Their employers and their managers themselves don't even really understand what the expectations are for them. So it's a really nebulous sort of concept that they're working with all the time, both in work and in the university. So on the whole, they're working on either the Masters in Advanced Clinical Practice Award or the Non-Medical Independent Prescribing Award. In terms of demographics, they're 25 plus, but they're usually more likely to be in the 30 to 50 age group. They've got established local career connections, and they're full-time or often more employment. So some of them have got substantive post and ending agency shifts as well to fund their education. So as I've said, it's an emerging, rapidly changing area of work where policy isn't staying still over the last 3 years. It's changed rapidly. The health and care systems they're working in have changed rapidly. Their work's multidisciplinary in nature, so it's boundary crossing with a lot of autonomy and very little team support. Where they do work in teams, they're often the leader themselves. The independent prescribers are working towards carrying responsibility for therapeutic decision making. So again, they're taking on a lot of responsibility without very little in the way of support in the workplace. And alongside of all that, the features of their roles are this uncertainty, ambiguity, and this sense of othering from their core profession as they've taken on a different range of values. So they're in quite a complex place themselves. And there's also then an intersectionality for them as learners, because they're more likely perhaps to be from the Black and minority ethnic groups. They're not traditional higher education candidates, often from working class or first generation background. And they don't engage in higher education in the same way as undergraduate students coming straight from home. So their circumstances are very personalised and specific to the individual. They're often both parents and carers, sometimes have their own health needs, and they haven't really engaged in the campus support networks that we put in place before COVID hit as well. And their views aren't represented in the usual mechanisms we've got to gather student opinion. So the other thing that I wanted to talk about as well is sort of a report came out earlier this year, which is recognising this unheard voice of the part-time adult learners, but also the likelihood that they're going to have adverse experiences of mental health from the effects of the most recent public health crisis. So life, money and flexibility were some of the themes that Butcher picked out. So life has changed rapidly for them in terms of workplaces, but also in terms of employment status and the inflexibility of systems, both inside work and inside education. And as you can see, what he suggested they wanted was inclusivity and signposts. So that's really where I'm sort of talking about today. I'm looking at how I've planned my approach. Chris originally asked me to talk about some of the stuff I was doing in my practice. The reality is that what's happened has changed considerably. So before COVID, my practice was very much low tech. It was a lot of play-based work, face-to-face small group teaching. I did a lot of stuff with Play-Doh and modelling, trying to encourage people to let go of their hierarchical thinking and sort of release their creativity. Go with that whole thing of creativity being mistakes. I used a lot of matching card games, drawing, some Lego play. The glasses there are some glasses made from pipe cleaners that help people to see things through a different lens. And it was really around trying to get people to look at creative problem solving, active learning and experiencing their own work environment in a very different way. Unfortunately, all of that goes then with the strike of COVID. So for the last 6 months, my students have been interrupted. They were interrupted en masse, and they've only recently been started to look at what's going to happen next. So we engaged with our employer partners, stakeholders, and they were not supportive of the return to a previous day release method of letting their students come back to learning. That's partly because of the implications of the workforce, the senior workforce, all coming out of work for a day, but also because they were trying to protect the mental health and reduce the stress workload on these students. So we've negotiated that they can come back to study and resume from an interruption, but that it's going to be a purely remote delivery. So that made me then look at what choices have we got. And for a start, I got very excited because I do like to experiment, and I'm still learning myself as an educator. And so I was looking at all the different things I could do, and I wanted to use short-term video, and I wanted to use animation, and I wanted to have lots of things that whiz and bang, and then very rapidly realised that actually that was going to be a problem for these students in terms of both the time and attention needed for me to develop the skills to do that and do it effectively, but also to consider their digital literacy and their digital exclusion risk. So, as I've said, they're working, they're carers, they're part-time. We're in a rural area. A lot of them may not have the bandwidth in their work areas to be able to access that kind of material. A lot of them are managing to look at it on smartphones in their lunch break. So things then really in terms of choice, I've always shied away from things like Panopto and Collaborate in my practice because I wanted that immediate reflexivity and the ability to change direction in small group teaching. So things that I've done in the past have been not necessarily recorded and not necessarily easy to use. So I then looked again about what could I do, and I've gone for a very, very pared down approach. So despite being postgraduate students, many of these learners aren't terribly confident in terms of their academic skills. Some of them, their learning difficulties, their problems like dyslexia have only been diagnosed once they've actually come into the higher education background. Some of them, again, have issues with digital literacy anyway, aren't terribly confident tech users. So having loads and loads of platforms is just going to increase their likelihood of not engaging with the stuff. And another barrier to it, again, is the fact that they're experiencing split demand in their roles. So that leads on to my COVID-19 pedagogical stance. which sounds very impressive. And that was a really about recognising the impact of the last 6 months on these learners as they return from study. So it's looking at loss and fatigue. There's some work that recognises that in organisational change, that's part of the process. And one of the things I'm really aware of is that they've been through a rapid change, not only in society as we all have, but in the workplace. They've been redeployed into different areas. They've lost their clinical support that was there. They've been asked to take on roles that were new to them. So they're coming from a place of high stress and rapid change. And really, you've got to unpick and allow all of that to be expressed and let them tell their story in many ways before they can actually move on to do any learning. So within that as well, it's not just about good pastoral care, but it's also the opportunity to engage with this student body in a really different way and hopefully get something a bit more meaningful than we had before COVID. So if we think of like education as a psychological contract and look at some of the work on this organisational change, then that acknowledging of that loss is really, really important in helping them to reconfigure and think about their roles and to sort of reinterpret their experiences. What it will also do is give us a lot of information about what works for them. So knowing them, let's say, stems partly from my own relatively recent experience of being one of them. And I've got an ongoing peer relationship with an honorary contract with them, so I do work with people in practice. And although that can mean that sometimes objectivity is lost, it also means that it's a really opportunity to find out what matters to them, which again I think is really important in terms of building a relationship. So for me, the relationship around what I want for them at the end of this is a sense of a community of practice, very much like we've got here, and also the ability to be completely self-directed learners, so that they'll come onto the programme possibly not with those skills that our regular undergraduates leave with, but by the end of it they'll be able to be completely self-directed and to go ahead and research things that they've got an interest in and find the information. So in terms of being able to do that, what I felt was really, really important was this concept of building and maintaining community whilst also delivering everything completely online and looking at the importance of connections. So, and say in small group teaching, a lot of the learning happens really, they would almost see this as by accident. It's when it's obviously not from that point of view, from a pedagogical point of view, it's very well thought out, I like to think. But their learning is happening in the times that they're seeing a social interaction. So that I was really keen to replicate that in a remote delivery. The other thing I wanted to look at was sort of social support as a form of learning. So what I've done is going for a very pared back approach, and the materials are sort of chunked into small areas. They're narrated PowerPoints, small recorded presentations, a lot of signposting. I've provided a plan that will help them to navigate through the online working week, and I've split it from a day release into a week, so they've got small chunks that can be picked up around caring responsibilities. We're launching with a face-to-face team seminar, so that we've got the opportunity to actually see and engage with each other and just have that chat, and then use the discussion boards throughout the week. So thanks, Danielle, to your discussion on that the other week. And then having a bring a brew session at the end of the week, where again we can just all check in and talk about what we've learned and how people are feeling in the same time. What I'm hoping to have is a sort of seek and tweak approach is what I'm calling it. So actually asking for opinions on things. So rather than waiting to the end of the module and having evaluation, just looking at asking them how it's going and being very reflexive and changing things as things go on. So that, hopefully it's like bringing in continuous improvement approach towards it. And hopefully what I'm getting from that is that they're going to feel part of a community and allow them to learn from each other. And really all I'm going to be doing is facilitating this. What I'm hoping the future will look like is much more an opportunity to sort of prove from the data from doing this that this is an approach that works for this student population much better than the traditional day release, which is what they've been offered so far. So I'm looking at whether we can consider how much place it impacts on their learning, and whether this providing a remote delivery means that the 2-hour commute that they've been doing so far is no longer needed. Also within that, looking at whether small chunks can be translated into work that's going on in the university about a micro-credential offer, and looking at whether, again, providing just like an outline and letting students contextualise their experience means that they can write their own learning outcomes. One of the things I'm really interested in is this pedagogical, which I'm probably not saying right, but pedagogical theory, and this theory of completely self-directed learners. And I'm hoping that we can facilitate that through this approach. So that's it in a nutshell. It's probably hopefully less than 15 minutes. But very
Yeah, you
much,
just avoided my rim shot.
I know, I've got it on there. Yeah, very much a stream of consciousness about what I'm doing and why.
Brilliant. Has anyone in the chat or got any questions at all?
That's good. I'm giving it away now.
I've got one. The place, and if Class Mohammed just get ready with his slides. The place-based learning. How are you planning to implement that?
I'm hoping we can explore looking at whether we can deliver things more remotely with sort of like an unconference type thing. I know you're hoping to plan an unconference, so I'm hoping to learn lots from that. But really, any face-to-face contact, I'd like to be nearer workplaces. So my students are tending to come from all over Lincolnshire just for 6 hours of face-to-face teaching, and that's not included with the coffee breaks, lunch breaks brought in. So it's not really great use of their time. So if we can maximise things so we only have very little face-to-face contact, then there's a potential to take that face-to-face contact out to them.
Brilliant. And just a quick comment from Amy, who says, really interesting to see how you've adapted your approach around your students' needs. And I think absolutely, I think there's a lot of really inspiring stuff there, and a lot I think everyone can kind of take a little bit of measure from. It
was weird because it's almost like a loss because I've been so excited by the play stuff and the hands-on, low-tech, drawing, teaching, playing cards. But it was very clear that actually in replicating that, I'd be going through something that they would just be going through a thing rather than actually learning anything. So it's new but very exciting.